Hey everybody, welcome in today. We have episode 9 here of our series, Dr. Whiting, and just trying a couple different things. Lighting is a little bit off on me today, but on Dr. Whiting looks great, so that's good. So we're just going to run this, and any questions you guys have along the way, please don't hesitate to ask, because this is just like the last ones. We want to be super interactive with everybody and try to get all the questions answered. So, episode 9, we're starting off with oral chelation and EDTA.
Yeah, folks, and wait till you hear the success stories that we've had.
Yeah, incredible success stories. So many, we're probably not even going to get to them all. But we're going to try. Heart disease remains the major cause of health complications and death in spite of advancements in science, and one of the less talked about methods for both preventing and possibly managing safely is chelation. Chelation is something that's pretty complex but pretty simple, I think, at the same time. Tell us a little bit about chelation.
Well, the word chelation means to bind, to connect. And so, for example, when we make a calcium supplement, we make chelated calcium, which we bind with an acid to increase absorption.
Yeah.
So, in this particular case, we're using various agents, amino acids primarily, to bind various substances in the body. And in this particular case, although there are other uses, but in this particular case, we're looking at binding calcium. Because when calcium adheres to the inside of your arteries due to free radical damage, that's when cholesterol, minding its own business, doing wonderful things for you, begins to stick to the calcium. And over time, we get a narrowing of the arteries called atherosclerosis. By removing the calcium ions from inside the artery via chelation, we can control this, because once the calcium is gone, cholesterol no longer sticks there. It floats away. And so chelation is a viable, relatively non-invasive way of helping to manage arterial occlusions.
How does EDTA play into that? How does EDTA play into
EDTA is an amino acid that is the primary chelate. There are others. But EDTA is the primary chelate. It is a synthetic amino acid, which in part is why it works, because the body cannot utilize it. It's artificial. It's unnecessary, and so it can stay intact and go through your bloodstream. And as it does, it begins to pick up those calcium ions through what we call ionic attraction. And over time, we have a fairly viable and relatively safe and successful way of restoring arterial blood flow.
So what's the difference between oral chelation and intravenous chelation? I know a lot of people they try to say that intravenous chelation is way better.
Intravenous chelation is far more aggressive. It's far more powerful. It is far more effective over the short term. However, there's a couple of drawbacks. Now, if you've got 90% occlusion of an artery, time is of essence, then you might want to consider intravenous chelation followed up with oral.
Yeah.
But two of the problems connected with intravenous chelation is, one is cost. You're looking at $4,000 to $6,000 for a series of treatment. Unfortunately, insurance companies don't cover this because it's not a quote-unquote approved method.
Yeah.
And so they only want to cover surgery and drugs and those things. but it works a whole lot quicker. One of the other problems, or potential problems with intravenous chelation, is mineral depletion, because it's not just going to be chelating calcium. EDTA is going to latch on to other minerals in the body. And that's okay as long as where you're going to get intravenous chelation, they're replacing those essential necessary minerals intravenously afterwards, so you don't become depleted.
Got it.
The advantage to oral chelation is it's relatively inexpensive. You can do 6 months to a year for a fraction of what you can do intravenous for. It's convenient. You can do it at home. You don't have to go to a clinic. And the downside, if there is a downside, is that it takes longer. Obviously,
that's why you're talking about it takes the 6 months.
yeah, obviously, you're looking at a lower dose. You're looking at it having to pass through the digestive system, but it does do so because, again, EDTA is a synthetic amino acid, so it's not going to get broken down. And you're absolutely right. We recommend that if you're going to consider oral chelation, you do so for absolutely no shorter period than 6 months.
6 months.
And that depends entirely upon the degree of your problem. A lot of people do 6 months off and 6 months on again every year. If your situation is more acute and the blockage is more severe, you may want to consider doing it indefinitely, continuously, because there's certainly no harm in doing so. And the advantage of doing an oral chelate is we can put the minerals in there that you might be losing, so that every time you take the chelation formula, you're replacing the essential minerals, so we don't have to worry about significant depletion.
And so what makes up a ideal oral chelation formula?
Well, EDTA, several other amino acids, vitamin C is absolutely essential for transport, some B complex, and a host of minerals that need to be replaced as a result of the chelation process.
So you pretty much, I mean, you've kind of perfected the oral chelation product. Has that changed much in the last 5-10 years?
Actually, the current formula that I have developed is an evolution. It's an evolution of the original. And it's gone through maybe 4 or 5 changes over the last 30 years, not a lot. But we're learning more about other chelates that we can include. We're learning more about ratio of chelates to each other. And as I have talked about before, ratio is almost as important as potency.
Yeah. Well, I hope you guys got a lot from that. Keep in mind, you definitely want to subscribe because this won't be the only oral chelation EDT video we'll be having. And any questions, you can type in the chat and we can get to the answers on any one of the social medias. The next subject we're going to discuss today is all the hype around Berberine and weight loss.
Well, Berberine definitely is not the whole story.
Yeah.
And it shouldn't be the whole game. It takes lots of other nutrients in concert. And unfortunately, Berberine, like a lot of these things, is rapidly becoming misused.
So Berberine has been in the news and they've been discussing it like it's the natural Ozempic. What are your thoughts on that specifically, that people are saying Berberine is the natural Ozempic?
Well, let's take a look at what Berberine is doing. And as I said earlier, it is not the only one. There are other nutrients, some of them far more effective than Berberine. That just happens to be the buzzword this week. And you know how humans are.
Yeah.
If a little's good, more's better. Everybody else is jumping on. Ooh, all the stars are taking it. Therefore, it must be the latest thing. I want some too. But here's the problem. Let's take a look at what berberine is actually doing. It is one of several nutrients that we use to regulate the production of excess insulin. Insulin is the hormone that is produced in your pancreas in response to the ingestion of sugar-forming foods.
Yeah.
So carbohydrates. All carbohydrates eventually become blood sugar, except for fiber. But everything else will eventually get there. Well, because of our high refined carbohydrate diet, many of us are living in a state of excess insulin production constantly, because as the glucose rises in your bloodstream, your pancreas pumps out more insulin to deal with it. And if you're hypoglycemic or diabetic, that's a whole different problem. Probably needs to be discussed another day. But let's talk about people who aren't diabetic or hypoglycemic. They're still getting an elevated insulin response because that's what glucose does. That's what your body does in response, because elevated glucose is not a good thing.
Yeah.
In fact, it's a dangerous thing. And the body has several mechanisms for getting rid of that glucose. And the main one is insulin. Well, insulin to excess increases the appetite.
Yeah.
Now we begin to turn around the circle, get back to berberine's benefit for weight loss. It increases the appetite. So if berberine can lower insulin production, it's going to conversely lower appetite. And that's essentially what all the latest drugs are doing. They're lowering your appetite, so you just don't care about eating. Now that has another long-term problem. That's called starvation hormones, and we've talked about those before.
Yeah.
Because if you go on a low-calorie eating program because you're taking one of these drugs, because now you're no longer hungry, over time your body's going to see that as starvation. And it's going to begin to slow your metabolism down, which is why, invariably, the magic of Ozempic and the other ones out there have a finite time of benefit for weight loss, because eventually you're going to plateau because your body's going to get scared that it's starving to death. And keep in mind that all of these drugs, including berberine, which is not a drug, of course, has its greatest benefit for type 2 diabetes.
Yeah.
And it is technically being misused for weight management. And there are many side effects connected with the use of these drugs, and even with the use of excessive berberine. So it's not a magic bullet. There is a price to pay for using it. You can go on the internet and look at side effects of Ozempic and these other ones.
Yeah.
And you might be quite surprised that there's a price to pay. There is no such thing as a magic bullet, especially a magic bullet without side effects.
Yeah. What other cofactors are needed for maximum effectiveness of berberine, so you're not using too much or too little?
Well, first of all, I would use supportive nutrients that similar to what we would use for someone with diabetes or hypoglycemia, and that would include chromium, vanadium, aspartic acid, key minerals like manganese, copper, and zinc. And when you use those in concert, then you're teaching the body rather than forcing the body to better regulate insulin production. And that, along with a controlled carbohydrate / sugar intake, oftentimes can help to normalize diabetes all by itself. But when you use it for weight loss, it would also be beneficial to use these cofactor nutrients, because I think the side effects or potential side effects of berberine would be less.
Yeah.
Because everything in life is dose specific. You know, you take 2 aspirin for a headache, okay. You take 12 aspirin, and then you may have a problem. So everything is dose specific. More is almost never better. Almost never. And the doses of berberine are very individualistic.
Oh, okay.
What one person is taking doesn't mean that you can take the same amount, because many people are hypersensitive to this herbal extract. So my recommendation, if you're going to use this, especially if you're going to use it for weight loss, you start out with a very low dose. What's that? 100 milligrams probably. And go up slowly to see how your system reacts to it. If you start out whopping with 500 milligrams twice a day, you may have some nasty gastrointestinal problems. And you need to find out what your own threshold is, number one. Number two, like most nutrients, if it's taken with food, your system can handle it a little bit better.
Yeah, and berberine is in the blood sugar support from Phoenix Nutritionals.
It is part of the conglomerate that I was talking about for regulating insulin and blood sugar.
And so, well, I guess we talked about the doses, and so the side effects of too much berberine would be the mineral depletion. That's really the main one.
Well, not so much with this one, but what we're really concerned about is gastrointestinal disturbance. And unfortunately, people who have developed this, some people who have developed this, even after stopping the use of it, their side effects or gastrointestinal disturbances have persisted for weeks or even months. So it's something you need to be careful of, and it's something that you need to realize that all of these things, whether they're drugs or nutrients, they all have a threshold. And finding out your threshold in advance is oftentimes the smarter choice.
Yeah, I think it's a great point. I mean, you have to realize everyone's bodies are different, and everyone's going to react to different nutrients different, and everyone's going to react to the different medications. So, yeah, always consult your doctor for those kind of things. And hey, don't forget to like and subscribe, because we're going to be doing another video here pretty soon about May being Anxiety Awareness Month and May being Arthritis Awareness Month also. So thank you guys, and see you soon.